How can one tell the difference between an arterial versus a venous ulcer?
Great question. Arterial and venous ulcers can generally be discerned fairly easily. Let's look at this graphic, and we're happy to provide this graphic and poster for your offices. The type of pain. Arterial generally causes an intermittent claudication pain. The ulcer is generally accompanied by intermittent claudication pain or rest pain. Whereas venous, it's sort of a dull, achy pain, okay? What about the presence or absence of edema? This is classic. Arterial generally do not have edema. They're not big swollen legs. Venous do. So edema is more indicative of a venous ulcer. What about pedal pulses? In arterial ulcers, generally the pulses are weak or there's no arterial pulse. And with venous, it's not an arterial problem, it's a venous problem, so arterial pulses would be present. What about the shape of the ulcers or the sores themselves? With arterial, they tend to be kind of well-defined, punched out holes, round, smooth sores. And with venous, they tend to be sores with irregular, kind of craggly borders, like this image here. And then finally, the presence or absence of pus and the sort of look and feel of that. With arterial, there generally isn't pus. They're usually dark and black, scab, ischemic tissue. With venous, there often is pus, and there's reddish skin, erythematous skin around there. So these are the general differences to discern arterial from venous ulcer. Occasionally, you can't tell, or they're mixed. So we recommend this algorithm. If you think there's an arterial ulcer, please refer to us, PAD specialist. If you think there's a venous ulcer, if you're sure it's a venous ulcer, you can refer to your preferred vein provider. If you're unsure, arterial or venous, or that they might be missed, the arterial component has to be prioritized. In that case, please refer to PAD specialist first. We will tell you if it's an arterial ulcer, and then we'll do our procedure, or if it's mixed, or if it's venous, we'll tell you that too. So hopefully this helps, arterial and venous ulcers. We're happy to provide this poster and graphic to you.